If you are considering having a total knee replacement, there are a couple of things you need to understand before you return to physical activity. Because if you rush things, if you go a bit too fast, you can end up taking one step forward and five steps back. So in this video, we are going to explain if and when you can expect to return to some of the common types of recreational exercise activities, such as golf, tennis, and running. If you haven't met yet, I'm Alex. I'm a physiotherapist with over 21 years experience working in private practice.
I'm Gavin, and Alex and I co-own New Zealand's only fitness studio for people over 40, and many of our clients come here with knee replacements and knee recovery. So we work with hundreds of clients who have had knee replacements and knee surgeries, and what we're going to share with you today is based on our sort of experience within the gym and physio environment and the best guidelines that come out of kind of research on the subject.
Now, before we actually jump into and talk about these activities, I'd like to quickly mention a story about a client that we worked with in the past. His name is Bruce. So Bruce had both of his knee joints replaced. The problem with Bruce is that he was too eager. He jumped in too quick. He started doing things that he was not meant to be doing. So I think he played golf. He tried to put too much stress on his knees in the gym. He basically did too much too early. So he ended up actually having to have another surgery within just a couple of months to fix the damage that he's done. So the purpose of this video today is to give you realistic time frames, so you're not going to do too much damage to your knee by getting back to your favorite activities too quickly. Right. So the first activity we're going to talk about is golf. Okay. So a lot of you are keen golfers, I'm sure, and you probably can't wait to get back to on the golf course. Okay. When can you actually get back to it safely? So first of all, you should be guided by your surgeon. But a general time frame would be at about 6 to 8 weeks. You can just start taking little tiny short swings. Okay. Putting and chipping, okay, 6 to 8 weeks, as long as your physio and surgeon is happy with it. Now, to progress a little bit further, so you can probably get to the driving range at about 2 months to 10 weeks, somewhere sort of in between 8 to 10 weeks. You can start taking like half swings. Again, we're not talking about pushing yourself 100%, but sort of you can take slightly longer shots at a driving range at about just over 2 months, okay? And if we're talking about getting back on the course properly and playing full games, 9-hole and 18-hole, we are talking at least 3 months. And again, caveat here, your physio should be happy with it, okay? You need to run it past your health professional before you get back on the course, all right? Now, one last thing I need to mention about golf is that it really depends on which of your knees is being operated on, okay? So your lead knee is taking most of the stress when you're swinging golf club, okay? So let's say if you're a right-handed golfer and it's the left knee that was done, it's probably gonna take you longer to get back on a golf course, all right? So that should be taken into consideration.
Okay, so by the way, Alex and I have put a knee guide together for you. So it's a combination of physio and both strength and exercise. So if you do want a copy of that full guide, come to the video and some instructions, just comment knees down below and we'll send that over to you. But the second exercise we're going to talk about is pickleball. This is really common with our sort of over 40 or 50 clients, okay? Very similar to tennis, and it's non-competitive. So when you're looking to return back to pickleball, you got to understand that there's a lot of rotation and pivoting involved, right? So you want to be taking about 3 to 4 months if you're engaged in doubles, because obviously you're not running around the court as much as you would with single players. And if you want to get back to single play, you're looking at about 6 months onwards. I know it's frustrating, but need to try to adhere by these sort of guidelines as well, so you don't do more damage like Bruce did.
Activity number 3, tennis. Okay, so tennis, as Gavin just alluded, tennis is similar to pickleball, but it is more intense. Usually tennis involves higher speeds, more kind of rotation on the leg, more lunging. So it is there's a higher impact. So generally speaking, most surgeons will probably caution you against playing tennis. However, it's not about yes or no, whether you can or cannot do it. It's more about how long would you like your prosthesis to last, okay? So if you decide to play tennis, you probably physically could, but it just means it's not gonna last, your knee replacement is not gonna last you as long. So generally speaking, knee replacements last between 15 to 20 years. So you play a lot of tennis, it may just not last as long. Now, to give you a rough time frame, if you are allowed to go and play tennis, you can start doing doubles at about 4 to 6 months. Okay, when I say can, again, you probably physically would be able to. Whether you should be doing it, this is kind of really up to you. Singles, you need to wait at least 9 months after surgery.
So number 4 will be running. So running is probably one of the most highest impacts, activities you can do. And actually, it's not recommended with physios and medical professionals at all, because it will wear out that knee super fast. Okay, so, and we can't stop you doing anything at all, but my recommendation will be to walk first. And I think we said maybe like after 12 months, if you are going to start running, that would be the most comfortable time frame. But like I said, it's not recommended at all in sort of medical environment.
Just want to add something to it. So it's really not black and white. It's not yes or no. The thing about if you love running, if this is how you keep fit, if your overall general health and fitness depends on it, and this is the only way you can keep fit, then you could argue that keep on running may actually the benefits of running could actually outweigh the risk of running on your knee joint. So if you do decide that you want to keep running, like Gavin said, you probably should wait for at least 12 months after surgery to even considering it. Now, activity number 5, hiking. So hiking essentially is walking, and you can start doing shorter hikes on a flat surface. For some people, after as little as 10 to 12 weeks, okay? Again, you're starting somewhere in a very controlled environment. So I always tell my patients that they should try a shorter hike within the urban areas, meaning that you can, if your knee suddenly starts to hurt, you got somewhere to sit on, have a break, and ask for help if you need it, okay? You don't want to be going into the bush straight away and getting stuck and then being rescued by a helicopter, okay? Start your hikes somewhere where you can get help easily, where you can sit down on the bench, have a rest, and then gradually, as you feel more confident, you can add a few little hills. Then you can actually go for a bit longer. So generally, if you can start adding a few gradients, a few slopes at about 3 to 4 months mark. Okay, and the longer hikes, meaning going out into the bush, into the forest, we're talking minimum 4 to 6 months. But again, I would recommend that you check with your physio or with your orthopedic specialist when will be the best time to do that. Now, one little tip about hiking. So you can actually take a lot of stress off your knee joints by using hiking poles, okay? That is actually a little strategy that can get you back on track, hiking a lot earlier as well.
Number six is going to be cycling. So cycling really is probably the best exercise that you can do post-surgery and even up to surgery as well. It builds the quad muscles up, okay, on the front of the knee there, and that's going to be super important. So you can start rehabbing and cycling from about week 2, but this is not cycling outside. This is cycling on an exercycle in a gym environment, because if you do go outside and maybe you fall off, you're going to do a lot more damage than you want to be doing. So keep it nice and safe in a nice environment on a stationary bike to make sure you can do that. But again, biking is a fantastic exercise.
Number 7, swimming. So swimming is probably one of the best suited exercise for after having a total knee joint replacement. Why? Because swimming is very, very low impact. In fact, you could argue it's almost no impact, okay? Now, the only thing to be aware of is because swimming quite often involves going into the public pools. And what do we know about public pools? There's lots of bugs in it, right? So you want your wound, you want your incision, surgical incision, to heal really well. It should look nice and tidy, dry, no oozing. So usually it takes at least 4 weeks for your skin to close properly. So make sure your wound looks nice and dry before going to a public pool. But swimming is a great way to rehab yourself, but also even further down the track, great way to maintain fitness. Pretty much there's very little restriction on what you can do in terms of swimming. The only thing I would say is be careful with breaststroking too early, because when you breaststroke, you do this kind of frog leg kick, which is kind of involves a bit of a sideways leg movement, and that can sometimes irritate the inside of the knee joint, okay? Just something to be aware of, but otherwise swimming is a great way to keep fit after a knee replacement.
Last one is going to be strength training, okay? So strength training is probably the best thing that you should be doing in the gym anyway. So what we're looking at here, you can break it up. So if you've just had a knee replacement and you can get around, like I've had people in our facility, sitting down doing upper body movements. Okay, that's cool. And you can do that probably like once the healing is starting to done, like maybe 4-6 weeks or so. But in a controlled environment with maybe with a personal trainer or somebody that knows what they're doing to support you, definitely wouldn't be lifting heavy dumbbells around the gym because that's not ideal. But if you've got machines that you can sit in and push and press, it's going to be great. So the thing with strength training, it is so beneficial. In fact, we had a client that joined us about 5 years ago, and she was heading for a knee replacement. And what we've been able to do over the last 5 years is strengthen her knee and her glutes and her hips and all that sort of thing. And we've actually delayed the knee replacement until just November. So she delayed it for 5 years, keeping that joint strong. And now she's back in the gym super quick within 6 weeks. And we're doing stuff in the gym. So strength training is really, really important. Again, if you're going to start lifting like heavy lifts like squats or deadlifts and things like that, you want to be looking about 6 months in, 4 to 6 months in to do it, and kind of like avoiding the rotational kind of things with your knees. So it could be sit to stands, it could be, maybe light leg pressing and things like that. But you've got to be super careful with it. But in terms of upper body stuff, you can be in there pretty quick, I think, as well. And just a reminder, guys, that we've got that free guide that you can get absolutely free. It's a complete knee strengthening guide. It's been downloaded dozens of times now. So comment needs to get that. So we're going to leave a video in the top left-hand corner, which is a whole breakdown of how to strengthen your knees. All right. So go and head over to that video, and we'll see you there very shortly.